Hi, my name is Paige Hegarty. This is my 3D information topic. I am doing AIDET communication skills that reduce anxiety in the healthcare. And this is my audience. So AIDET is a powerful communication tool that is recent and is in effect in hospital centers, outpatient care centers nationwide, and here in the Hawaiian Islands. It is to increase outpatient outcomes, and it is to decrease anxiety. So my name is Paige Hegarty. I work as a phlebotomist at clinical laboratories at the Hilo Medical Center. I've been a phlebotomist for about 2 years, and I've currently been using these AIDET skills for about over a year and a half. So, do you guys feel anxiety or nervousness or vulnerability when you walk into a healthcare setting, like a hospital or a lab or anywhere to get anything for your health care?
I do.
Yes. Yeah? So this is what AIDET was created for. It helps to decrease that anxiety and your nervousness and your vulnerability. So today what I'll be talking about and going over is what is AIDET, who created AIDET, and what does AIDET stand for. And then I'll do a demonstration at the end on what AIDET may look like. It comes in different forms, so I'll be doing it on the view of my phlebotomy experiences. So we'll be going over what is AIDET. AIDET is a powerful communication tool, like I said, and it helps to reduce the feelings of anxiety, vulnerability, and nervousness. Also, it helps to increase clinical outcomes by decreasing your anxiety, like I said, and increasing compliance. So, who created AIDET? AIDET is created by Studa Group, which is an organization that put together this AIDET tactic to help combat those anxiety feelings that, which is normal for everyone to be feeling. And they dedicated and worked with over 800 organizations in the healthcare system nationwide in the U.S. and beyond. Also, they put together these AIDET tactics that have been proven to create a great and consistent culture of experience and great outcomes. So it's very, very useful as a communication tool. So we will be going over what does AIDET stand for. So AIDET stands for acknowledgement, introduction, duration, explanation, and thank you. So we'll start with acknowledgement, A. So that will be, we will acknowledge the patient by greeting them with a smile and a gratitude and a great attitude, actually, with any of your patients. You just want to welcome, you want to make them feel welcomed when you're with them. And we'll go over to I. So I is introduce. We will be introducing ourselves politely to your patient. You want to just, this will decrease their anxiety a little bit because they're going to know what, how you're feeling, or they're going to know who you are. And so what you'll do is just tell them who you are and how long have you been doing this and where are you going to be doing this at, and so just introduce yourself. And next we'll be going through duration. You want to let them know how long the procedure is going to take. You want to ease the patient's mind and you want to keep them at ease. So you want to make sure that you're only there for 5 minutes. You let them know, hey, I'm expecting you to be here for 5 minutes. Next, we'll go over to explanation. This is where you want to explain the procedure to your patient or your family or the patient's family member. This is because you want to have them feel at ease as well, because they want to know what's going to go on with them. They want to know what's going to happen, what's going to be expected of them, and all that. That's the main key. So here in the explanation, you want to practice talk, listen, and learn. So while you're talking, you want to ask the patient if they have any questions and if you need to repeat anything, because you want to listen to them and what their special needs are. And this is where you learn. You want to learn. You can always take home a learning experience with your patient. And lastly, you just want to thank the patient. Thank them for their time and their compliance. Thank you for just having them there, because they came out of their way to come to you for help. So give them that attitude of gratitude type of feeling that they should have. So let's go over AIDET. So we'll put it all together and I'll give you a demonstration. So it could look something like this. Hello, Mrs. Whitefield. My name is Paige Hegarty. I am here to draw your blood at clinical laboratories. If you can follow me and have a seat in our phlebotomy room. So again, my name is Tasia. I've been working here for about 2 years. I have been known to be a very good phlebotomist, and my phlebotomy skills are above par. And if you have any questions, your procedure today is gonna be about 3 to 5 minutes. We'll be drawing some blood for some tests that your doctor ordered. So what we'll be doing here is I'll be tying a tourniquet around your arm. We will be finding a vein of good use. Then we'll do a quick blood draw, and we'll put your blood into some test tubes, and you'll be on your way. So if you have any questions, just let me know. I will be here to answer it. And after the procedure's done, this is how it will be. Thank you, Mrs. Whitefield, for choosing Clinical Laboratories. My name is Tasia. I drew your blood today. If there's anything I can get for you right now, just let me know. But here's the way out, and thank you for your time. So basically, that's what AIDET would look like for me as I draw people's blood in our outpatient lab center at Clinical Laboratories. Overall, AIDET is a simple acronym that actually just represents how we can gain trust and communication with our patients, because it's between patients and physicians and nurses, so anybody in the healthcare setting. And this is how we're going to reduce their anxiety and their nervousness. So according to Studer's group, this is a very effective communication tool, like I said in the beginning, because this is improving our interactions between hospital patient care associates and those who we serve, like patients, the patients' families, and even the visitors. So the next time you guys are at a laboratory or a hospital or a patient care setting, you guys think to yourself that, do you guys feel comfortable? Do you guys feel like you guys are knowing what's going on and what tests are going to be run? Because AIDET should be in effect here in the Hawaiian Islands, and it should be in our physicians' offices, in our hospitals, around. So is there any questions?
No.
No? Okay, thank you. Have a nice day.